Welcome back, everybody, after your lunch break. I hope you had a bit of downtime and are refreshed to go into the next session. And in this session, we'll hear the first of two contributions around building research careers, which is obviously a really pertinent topic to you. We will see the other two entries in the science communication competition, and we'll also give you some information about the different breakout rooms that are planned for the second afternoon session. But kicking it all off is our next keynote speaker, which is Professor Hannah McGee, and she is the Dean of the Faculty of Medicine and Health Sciences in the Royal College of Surgeons. And Hannah will give her keynote on the jigsaw puzzle, forging a successful and fulfilling career in research. And please all enter all your wonderful questions that you will have into the Q&A box, and we'll chat to Hannah after the video. Thank you.
Hello all. Thank you to the HRB for the invitation to speak at this Ones to Watch conference. I haven't talked on this topic before, and I was reflecting that some of the best advice on forging a successful and fulfilling career in research is likely to come through in-person conference attendances, those late night intense conversations, either with people you know but don't normally get time to talk to, or newer colleagues from other countries or other universities. So this is an alternative for 2021, and I hope that you might take at least one thought from my presentation today that you might want to think about for the next in-person conference you attend as you continue your planning for your career. The outline of my presentation today, I'm going to introduce myself briefly, then say a little bit about the fact that as a researcher, you're really planning for a life of transitions. I want to say a bit about building expertise and building your social capital, and an opportunity then maybe to take stock, thinking about both the benefits and the challenges of a research career ahead. And I guess to make the point here that success really is about a jigsaw of a whole range of activities that add up to making a successful and fulfilling career. Not just the papers, not just the grants, but a whole range of other aspects as well. Very briefly for myself, I'm a health psychologist, and my career has been spent in health systems research, looking at mainly cardiovascular disease. Did my PhD in Trinity, got some teaching experience as I went through there. I got a postdoc and a lectureship. My very first grant was with the Health Research Board for a PhD student. I then, and this is something for people to think about, I became very involved in my national professional body in psychology, became president of the European Health Psychology Society. If I was walking straight up the ladder, I might have decided that was a way in which I was not writing papers, not getting grants, etc. But actually looking over my whole career, it's the way that I got to build lots of skills about running meetings, about how to plan and consult to get things done, and cooperation. So do think about those aspects of your career development other than your research activities itself. So I became a fellow of the Psychological Society of Ireland, of the European Health Psychology Society, became head of department. I got my first million grant from the Health Research Board in 2003. It was at a time that we applied for £1 million punts to look at healthy aging, a north-south study. And by the time the grant came around, we were in euros, and so we got €1 million rather than £1 million punts, which left us about 20% short, but we were nonetheless very grateful for funding from the HRB at that point. In terms of becoming head of Division 3 departments, one of the things I'm most proud of is that we got funding for a structured PhD program in health services research in 2007 from the HRB. As a social scientist, I was particularly pleased because that was the first structured PhD program outside of the biomedical sciences. And I have here the logo of Sphere, not because I have anything to do with establishing Sphere, which is an ongoing 3 times funded national now structured PhD program in health systems and population health research, but because we started the first grant. And my pride is that with no involvement from myself, many other people have continued and made that more successful. So again, I think one of the things to be proud of is things that you start off, but that they survive and they thrive without you. And finally, I've spent the last 10 years not being a researcher, but in a leadership role in the university. But one of the things as a researcher to my core that I was very proud of and very keen to work on is to apply for and be awarded a DSc by the National University of Ireland. And that was really important to me in terms of saying that the body of research that I had completed over my career did add up to a significant contribution to knowledge. And I think that's really important that we sort of think about what is the body of research that we're creating, and how at any point in your career can you say, here's how this is contributing to knowledge, which is really what research and universities are all about. So just to comment a little bit on the fact that a career in research really is a career of continual change and transition, constantly thinking about the next aspect of your career, and that's tiring as well as exciting. And there are certainly people who decide that that's not for them early in their post-graduation, postdoc careers. And if you're someone who doesn't like change, you've got to think about what does that mean for your career. The kinds of changes that are involved, you see here, from new places to making decisions that increasingly will involve an impact on partners, families, and so on. But there is a cost to change as well as a thrill. So it's worth thinking about how often you want to change, and the kinds of transitions and the costs that are needed over and above what the new job is offering. There's also, of course, the thrill of change. So, but it is something that suits some people more than others, regular changes. And I think increasingly in research careers, the best way to advance a career sometimes maybe by leaving your current position and advancing elsewhere in a kind of a zigzag, where you may find a career opportunity outside your own organization that is not currently available internally. But it does require being familiar with and being used to change. The next thing to say, I think, and again, I certainly wasn't good at this early in my career, was to take the career advice that's on offer. There's a HR logo, which I think most Irish universities now have, in terms of human resources and career development for researchers. And that really was a response to many early career researchers feeling that they got very little guidance on their careers other than to research and to publish and to present at conferences. And this is just one example. In RCSI, we use Vitae. I think many of the universities use Vitae, but it's a way of looking at your CV, not just in terms of your knowledge and your skill set, but also in terms of your personal attributes, in terms of your people engagement, your people skills, and in terms of governance of the work that you do, and governance of research. So again, important to think about what skill sets you're developing there. It's also important in terms of thinking about skill sets to think about the role of others in helping you to advance your career. And I think we often think about the power roles, who are the important people that you want to influence or sponsor you and look out for you. But it's also important to think about where do you get your information and who are the people who help you to develop in your career. They're not always the same people. Very briefly, and I'm happy to share these slides with people, in terms of information, who is in the know, who can tell you what you need to know, who's good at inspiring you in terms of new ideas or different ways of thinking about your writing and so on, who's the expert, and then who's the person who's able to help you understand what might be needed in the next job, or in upcoming opportunities. And they're very often different people at different levels in your career, not always people who are more senior, and not always people in your same organization or your country. So build a wide network of people to check in with in relation to different aspects of your career, and keep that jigsaw in mind, that notion that there are lots of pieces to the puzzle to help you progress. Obviously, there are people who are senior and more powerful in your career and in your work environment that may allow you access to resources, whether that's funds or data or their time. There are people who will work for you behind the scenes to win support. Very often, the value is of telling people what it is you want to do. I wouldn't mind getting some experience on a committee in college. I don't have anything like that in my CV. What about being on the research ethics committee? What about being on a grants review committee? What about if you haven't got time to review some papers, you might recommend me as a junior person on your team. So sometimes with influencers and sponsors, you need to let them know what it is you think you might need their assistance with. And again, people who are good at connecting and introducing you to people who may help with your career and help with career advice. In terms of apologies there. There are other people who will help you develop. Sometimes they'll be able to give you constructive feedback on how you're doing, very often only if you ask. And indeed, people who help you improve are also people who might challenge you to say, is this really the right decision? Is this really the right way to approach something? There are people who will help you to stick with it and strengthen your resolve when you're feeling down and out about something. And there are also people, and it's important to have those in your life, who remind you that maybe you're getting the balance out of kilter, or that you're paying too much attention to something and maybe dwelling on things that are not working. You need to move on. So it's worth thinking about your next transition. The next time you're sitting in front of an interview panel, what is it that you need on your CV then, and how are you going to go about from now to getting that? And one of the things that certainly I've seen over my career is that very often, especially early in people's careers, many people don't look closely at the job specification. What exactly is the employer asking? Is it a mix of education, research, committee work, teamwork, etc.? So make sure that in your letter of application, your CV is actually tailored to the particular role that's in front of you. And that means tweaking your CV, tweaking your letter a little bit every time. And many of you will be asking your senior people to be a reference or a referee for you. I've done hundreds of those in my time. It takes quite a bit of time to be a good referee. You've got to read what's in the job specification and think, how does this candidate, how does my staff member, my researcher fit that? And I would encourage you to help your referees. So identify some key points that are being asked for in the particular job at hand, and highlight how it is that you feel that you have how you match those roles, and make it easy for the referee to write a tailored reference. When you're on an interview panel, it's really easy to see the reference as just a standard reference sent out for every role, versus the reference that's really talking about you, the person that's sitting in front of them. And the other thing I would say is I would strongly encourage you, especially earlier in your career, to get someone to look over your CV. Ideally, your senior person. I think I have found in my career more junior staff and researchers feeling a bit awkward about saying I'm applying for something. My view has always been, I don't have a permanent role for you in a research contract, so I want to help you to get the next best role for you. So ask people for advice, look over your CV. Very often early in your career, you're not good at translating the skills and experience you really have to the job at hand. So make sure you get the best advice before you submit a CV for a role. And really, in terms of roles, successful career transitions are really not down to one big thing, one set of papers and so on. It's about lots of little things that will add up to a well-rounded CV. And so I encourage you to take some of the opportunities about being on committees, assisting, for example, with a local or an annual or an international conference, so you get more experience under your belt, and you're able to demonstrate that you're a team player, that you put your hand up for things, that you've been innovative, and so on. Many of us arrive at career junctions, and sometimes they're about, do you stay in your current organization, do you take new opportunity elsewhere, and the pluses and minuses. And certainly in some situations, it can be easier to succeed in an organization by going away in order to come back. So go elsewhere for early career experiences, and then you're able to transition back to a more senior role. It can sometimes be harder to transition up within an organization than out and back. But in whatever you do, I would recommend, and do you want to be part of a bigger team? Do you want to stay working on your own? Would you like, for example, in these photographs, would you like to take on a role that involves more education? And what are the challenges in relation to that? Wherever you want to move next, think about mentorship. One of the things we did in RCSI in 2015, myself and the director of research at the time, was to launch a program called STAR, Strategic Academic Research Program. And we went looking for early career researchers as lecturers. We gave them protected time, and we provided a mentorship program to enable them to reach tenure. And the idea there was that we were going to both support but also challenge you over 3 to 5 years to become permanent. But you got a lot of personal mentorship about how to present, how to write, where to present, grants to apply for, how to start getting involved in education, how to get involved in committee work, and so on. And it's really important to find out what sort of mentorship would be available to you for your career success in terms of moving to a new role, a new situation. You'll find that out by asking people about the organization. This is what sort of attributes are they a successful organization, and so on. And you'll also find out by asking an interview, what will be the mentorship opportunities for me here, etc. So do plan to invest in that very, very overt way in your own career. This is just an example of our own organization, RCSI. We're the top 250 in the world in terms of times higher. So I put this here really to remind you of, be proud of where you are currently. In every organization you're going to be, in every university, there are problems, but there are also assets. So what is your university good at? What makes the place good for supporting your career development? And then equally, in terms of where you're thinking about moving, ask about the culture of the place, not just the rankings and the reputation. Is it somewhere that's very aggressive and competitive? Is it somewhere that builds confidence, that provides mentorship, etc.? So I would ask either those who work there or who haven't worked there, who know about the organization, where am I moving to? It might look better on paper, but is it the sort of organization that you are going to thrive in? I think that's really important. I think it's important to signal in terms of research careers. It's very easy to burn out because there's never an end to the day, or never. There's always another paper to write, grant to apply for, and so on. So we've got to challenge ourselves and remind ourselves that we've made huge progress. And you surround yourself with hugely ambitious people, so it's easy to really be on a permanent treadmill. So I guess we've all just got to maybe with our some of our people development, our anchors, help us to sometimes take an anchor and reduce the stress of what we do. I put this Lonely Planet book image here just to remind us all that research careers are extraordinarily exciting careers. You get a chance to travel, you get a chance to interact with international colleagues and organizations in ways that are really very unique and very satisfying for people. So, you know, the kind of engagements you'll have with somebody because you're in their city, in their universities, so different than being a tourist. And it's such a wonderful privilege. I have thoroughly enjoyed my research career and my understanding of my particularly European colleagues in different countries and different perspectives and so on, that I think it would be hard to match in almost any other career. So there are wonderful things about being a researcher and having that kind of, in a way, open invitation to go anywhere that there are other good researchers who want to work in your area. This is maybe a slightly bemusing, at least, way in which somebody's depicted how research careers evolve. So you start as a researcher, you end up then spending a lot of your time teaching and being on committees, and then as you get older, you spend all your time at lunches and dinners. Not so sure about the lunches and dinners, but it is true that if you're a good researcher, you will be spending times on committees, and some of that is not so great, and some of it is really important. If your research means anything, you have to get out there and make sure, in my case, my research is about health systems, cardiovascular research. So you've got to make sure that that evidence is getting into committees to inform policy. And depending on the scientific area that you're in, you've got to follow, you've got to take your research into places where it makes a difference, where it turns into policy, practice, changes in actions and so on. And for many of us, there is the thrill of teaching. Some people are not so keen on teaching in their career, but many of your career opportunities will be combined teaching and research careers. So in your early career, offer, for example, to review papers if your supervisor has lots of papers to be reviewing and doesn't want to do all of them and often turns them down. Offer to do that. Offer to be on a conference committee. As you get more senior, offer to be on grant reviews committees. Offer to be on the ethics committee in your organization. Etc. All of those kinds of things help your committee work to inform and support your research work. So I want to thank you in finishing. I want to wish you all well. If you're listening today as part of Ones to Watch, I expect it's because you may have some thoughts about your career just now. maybe worrying about how to get there, what the next steps are, and so on, and how to, anyway, how to thrive in what's both an exciting but also a very challenging career in research. And so my last bit of advice to you really relates to the issue of burnout. And I would say, we spend all of our time writing to-do lists, what we've got to do next. And I would encourage all of you, maybe perhaps at the end of the year, to have an annual top 10 list of things done. We very seldom just stand back and acknowledge what we've actually achieved in a year before we start to plan the kind of January things to do list. So do take stock of where you are. Sometimes that can be useful even for CV purposes, what you've achieved. And I wish you well. I hope you get back to exciting in-person conference presentations soon. There's nothing like presenting to a live audience, but also all of that kind of chat that goes on around conference events with new people, peers at your own level, with senior people, and so on. And also, of course, conferences, they're inspiring, they're career developing, and they're also fun. And so I wish you a great 2022 in getting back to see and meet your research colleagues and to help advance your career and your career thinking. So thank you very much, everybody. Thank you, HRB, for the invitation. And I'm happy to deal with questions and answers or comments after this. Thank you.
Brilliant. Thank you very much, Hannah. That was very, very interesting. I particularly like your recommendation at the end there to take stock and to acknowledge what you have achieved. It is very, very easy to forget about that and to be constantly in that race along the wheel and the hamster wheel sometimes. And I think that actually holds true across any career stage. Now, you were also talking about making sure that you ask people for help and that you probably would benefit if you're not very experienced in doing that. It would probably be beneficial to have a safe space to practice that a little bit. Guys, start here and now. There's a Q&A box there for you to write in, and we would welcome any questions coming up. And Robert has asked one here already, which is saying, very enjoyable, thank you. Is there anything an undergraduate student could be doing aside from getting research experience in order to increase their chances of getting a grant for a PhD in the future? And would you discourage someone from doing a PhD in the same institution where they received their undergraduate degree? Hannah, any thoughts on that?
Hello, Robert. I think there are things to, it's about letting people know that you'd like opportunities. So apart from lots of universities will have summer research projects that you can take part in research and plan a presentation, write a paper. But aside from that, I think many of our organizations have big conferences coming up. So if you're in a department of, I don't know, immunology, let's say, is that department running a national or an international conference in the next year? If so, can you help out? Lots of bodies needed on the ground when conferences happen. But there's also lots of opportunities to be on committees in advance of that happening and to see how those things are planned. And those sort of things are useful on a CV to have been part of the planning committee, scientific committee, and so on. And as an undergraduate, you might be saying to somebody that you ask, I know I won't be an active participant in the committee. That's not an area I know enough about, but I will be there to help. And I want to observe. Ask to be an observer. And I, for example, think in some of our research ethics committees, we should be involving undergraduate and postgraduate students as observers of how committees run, how decisions are made, and so on. Getting involved in the understanding about confidentiality that you have to undertake if you're part of a committee and so on like that. So if you feel that that they're going to say, well, there isn't really an active role for you, of then just saying, could I be an observer? I want to learn how these things work, and I can help on the days and so on. So that's one thing. The second question then is about doing a PhD in your own institution. It really depends on the opportunity that's available. If your mentor is really the best mentor, your supervisor that you're likely to find, then great. You know, we have international stars in many of our universities. They're top ranked in their fields, and so you're probably not going to get a better supervisor anywhere. If you feel, well, maybe I might get a better supervisor by going elsewhere, then go elsewhere. But I would also talk to people in your institution, and there's two kinds of people to talk to. One is you may often have enthusiastic supervisors like myself who want to hold on to the best students. So they're going to have that bias of thinking, oh, you're one of our premier students. You've done a project with me. I'd love to have you come and work. But maybe ask them or ask others that question of, should I stay or should I go? Like the song says. Because if you go, you can come back as a postdoc to a really great team in Ireland. And if you stay, you're really thinking, I do a PhD. What's your next step then is definitely out, maybe to a lab or a program that they might have connections with. So I'd kind of ask the questions around in depending on your own discipline. There will be slightly different nuances of what people expect in different disciplines. And so do ask a range of people, not just a potential supervisor, about what you think is the best offer.
Brilliant. Going on to the next question from, that's just jumped, from Molly Byrne, who is saying that Professor Hannah McGee is a wonderful advocate for a research career. We're so fortunate to hear her experience. She's been a great mentor to many people over the years, including me. And I would love to hear Hannah's advice for all researchers about maximizing the impact of their outputs and publications. It can be hard to fit these into a busy research career, but are often considered the most important metric for recruitment into academic jobs.
Okay, and hello, Molly. And for people who don't know Molly, Molly's been serving on one of our COVID committees in terms of understanding human behavior, and nothing more important, I think, in this pandemic than understanding behavior of all of us, and then the behavior of politicians. I'm not sure if she managed to do that. Our first professor of public health in RCSI was called the Professor of Hygiene and Political Medicine in, I think, 1868 or something. And it really did. COVID just taught us that's exactly what it's all about. It's about basic standards of hygiene, and lots of public health is about politics and convincing politicians. And linking to Molly's question, then it can be very frustrating, and she's right, very time consuming to get involved, to try to get your message into a forum, whether it's about the environment or road safety or something in healthcare and so on. And you can often hear, I suppose, messages regurgitated many, many times, thinking, we know the evidence, why don't you change? And I think, so I think it is a long distance trek, I think, to try to bring about change. Just because you found something fantastic in your research, and it's also been found internationally, it doesn't always drop into practice. But if you think about the at least 20-year campaign that people would have had to challenge smoking, all of those pieces of, if I use that jigsaw, all of those pieces of efforts by everybody for that couple of decades were the things that got us over the line in relation to the environmental protection ban in 2004. So you've kind of got to have a philosophical belief that you're going to be one piece of the jigsaw, but you may not be the one that's going. It's not going to be you that's sometimes going to make the big change. So it's like everything else. I think that, they talk about the 80-20 rule, maybe the 90-10 rule if you're in your early career, where you do need to in a way deliver on your research and focus on papers, but working out, I think, maybe the most impactful place that you can contribute, and keep pushing the information in a way. And politicians, I guess they have to start to look for evidence as well. And so I remember hearing, in fact, the HRB ran a session with some of our Canadian colleagues, and they talked about the 1-3-25 rule of put your key message on a single page, say a little bit more about it in 3 pages, and then if you want a more detailed outline of the study, put it in 25 pages. And that's more maybe in relation to health and health systems, but you've got to create the message in a way that people can digest. And it is we're all incrementally contributing towards pushing whatever the change might be over the edge. But it can be a frustrating and time-consuming activity indeed.
And of course, sort of think from the very beginning about how you might include those knowledge users and those politicians into your work as far as possible and as far as appropriate from the beginning, so that they don't get a glossy brochure at the end, but they've been in an integral part of it all along. We have loads of questions here for you, Hannah. We are very short on time. It's flying. A very quick answer, if you may, for a more personal question. There's Gillian asking about the idea of a top 10 at the end of a year, and what would be your top 3 for your research career? On a personal note.
Okay. We developed some questionnaires around quality of life assessment that were unique and allowed people to identify the key things that matter to them and their quality of life, rather than just a list of questions about, you have a pain here, can you lift that, and so on. The second one was SAVI, which is a survey which will be 20 years old shortly, unfortunately not repeated yet. It was a sexual abuse and violence in Ireland study, and very important because I was asked would I do it. So it's a population study of 3,000 people about something that was incredibly hidden. And this is before the Ryan report or any of the, so we got a baseline population study. And the thing that's important for me in that, for those researchers listening today, is I was asked to do that initially. And I said, no, I don't really do mental health research. I'm a health psychologist. I focus on physical health. And they came back to me and said, well, maybe it's not methodologically possible to do a study like that. And that was the hook that caught me. I thought, if I'm anything, I'm a researcher, I'm a methodologist, and there must be a way that you can ask tough questions. Because in a way, that's what all researchers do, whether you're in the lab or you're in the clinic or your population surveys, you're asking difficult questions or questions in a new way to find out the answers. So that was the second one, I think. And probably my DSC, I'm very proud that it all added up. But maybe most importantly, in terms of the lessons for today, is think about the skills you have, the scientific framework that shapes your brain. Not everyone looks at the world in that kind of way, and it's a really useful. Whether you're going into a new committee in an organization, I find lots of the things I learned as a scientist really help me in my current role. So don't undervalue the skills you have or keep them locked into your particular scientific question.
Brilliant. Thank you so much for that conversation, Hannah. That's been a pleasure, and lots of messages to take away for everybody, I think.
Wish everybody well.
Thanks, Hannah. Okay, we are now going to look at the other 2 videos that are participating in our science communication competition, and Annalisa is going to introduce you to those.
My notes. So is Dylan Keegan. So he's a research assistant from the Department of General Practice in Galway, and he has been working on COVID-19 award and focusing on the National Ambulance Service response to COVID-19. And then Katarzyna, I hope I can pronounce well, Katarzyna Kajeska, who is a postdoctoral fellow and knowledge broker from a secondary data analysis project. And she's based at the School of Public Health in UCC. So you can play the video now, thanks.
In January 2020, I started a new job and got what I had wanted for years, an office with a window. Unfortunately, in March, a mere 7 weeks later, my work project stopped and I began work from home. But the new project I began was so topical and so interesting, I put aside my grievances with losing my lovely office and window to the side. This project focused on COVID-19 and the Irish National Ambulance Service, in particular supporting and informing healthcare workers and ambulance personnel. The ambulance service are at the forefront of the pandemic response, involved in assessing, treating, transporting and importantly testing COVID-19 patients. They faced unprecedented times, an overload of information from news articles, government web pages, journals and media. They needed up-to-date information on all things COVID-19, they needed to learn from other ambulance services worldwide to find out what they were doing, and importantly, they needed to evaluate their own adaptive practice and response, so when future waves or pandemics of this nature emerged, they knew what was going to work. How could we achieve this? The first thing our project did was create a weekly international updates newsletter that gathered ambulance-related information worldwide from peer-reviewed journals, government web pages, ambulance, news and social media sites. We shared this with ambulance managers and staff. Readers of the newsletter found it clear and informative, and many shared it with their colleagues and within their organisations. Secondly, we created an international network of senior ambulance personnel from 12 countries to learn and share experience of how ambulance services were responding to the pandemic. We helped to share information among international ambulance personnel about PPE practices, COVID-19 testing of ambulance staff, and many other informative topics. Lastly, to underpin our entire project, we needed to create an evaluation framework that could be adopted by the ambulance service to help them assess their pandemic response and learn about what they did well and didn't do well. We searched for evaluation tools and methods and conducted interviews with staff members working in the COVID response room, a centre that managed referrals and organised home testing for patients at home and individuals living or working in residential facilities. These interviews provided a robust qualitative investigation of quality improvement and leadership approaches during this time. They helped us to develop a framework that could be used in future waves or pandemics, as well as future practice to facilitate evaluation on an ongoing basis. Nearly 2 years later, we hope this pandemic is a once-in-a-lifetime event. The WHO suggests this is unlikely. For that reason, our 3 key takeaways from this research include developing robust, useful and evidence-based communication, information sharing and evaluation methods. This is an important legacy to create in case of future pandemics. Outputs from this project could encourage the ambulance or wider health service to adopt evaluation routinely in their practice, improve communication channels and generate information sharing networks to learn from other national and international colleagues. The nature of the pandemic was rapid. Rapid changes to health services, rapid adoption of new practices, rapid sharing of information to learn about all things COVID-19, and rapid evaluation to learn from these changes and better prepare us for the future. All of these things can be implemented successfully if we communicate, share and evaluate along the way. And I may possibly make it back to my office and window. Thank you.
Hi, my name is Kate, and together with my LEGO crew, I'm delighted to present the findings from my HRB-funded PhD today. I have to acknowledge the researcher's bias first. I have type 1 diabetes and I'm on an insulin pump. I was diagnosed in 1987 and I had to take injections, sometimes even 10 a day, so I probably shot millions of them already. And I just got rid of them. And yeah, that's me when I was 7. So I got an insulin pump, a small device that delivers insulin continuously, and then when I wanted to eat something, instead of an injection, I just had to click a few buttons. It gives more flexibility, improves the quality of life, makes diabetes management more effective, reduces diabetes complications, and it's not only me, there's plenty of systematic reviews and other evidence highlighting it. However, it requires good diabetes education and multidisciplinary approach, ability to carb count, the willingness to be attached to a device, and money, of course. In Poland, I had to pay out of pocket every month at least €100 for infusion sets and every 4 years, £4,000 for the device itself. So when I moved to Ireland and I learned that it's all covered by the long-term illness scheme, I thought, whoa! But in terms of accessing technology, I learned it was a very, very different story. And this is where this mixed methods research begins. First, with my supervisors, we had to assess the prevalence of type 1 diabetes. There's no diabetes registry, so we analyzed the prescription database. Only then we were able to estimate the uptake of pumps across the country. We found that only 7% of adults were using pumps in 2016. And just to mention, in the UK it was 15, in Germany 35, and in the USA, even 58% of adults. The uptake varied fivefold between the countries, from 2% in Clare or Kerry to almost 10% in Kildare, Wicklow and other Dublin areas. The uptake was centralised and clearly associated with the availability of insulin pump therapy in diabetes clinics. Our national survey showed that 1/3 of clinics was not offering any type of insulin pump therapy services at all. Some clinics only provided the follow-up care, and less than a half provided training and education to commence insulin pumps necessary to start the treatment. And even in those specialized clinics, only 13% of patients were on pumps in 2018. After 4 focus groups with people with diabetes from the areas of low, average and high uptake of pumps, and 21 interviews with healthcare professionals and key stakeholders, we found that the determinants of access and uptake of pumps are the capacity of the clinic, mainly resources and expertise, structure of the health services at the local, national level, awareness of technology and its benefits, and impact of an individual. As one of the participants said, HCP and their attitude towards it as gatekeepers is absolutely huge. They are a key barrier or facilitator. Data synthesis showed us other determinants. So if you live in the right place, you get the best care. If you live in the wrong place, you get screwed. So what? This study highlights that there is inequality in accessing the best quality of diabetes care in Ireland, and access to medicines and treatments is much more complex than just dependent on reimbursement. The greater the awareness, the more chances for change. So thank you very much for listening, and thanks to the HRB for this opportunity. Bye!
Great. So at this point, you have listened and watched 4 videos. So the voting is now open, and it will close at 3 p.m. So please have your say and vote for one finalist to win. Please remember, you can just give one vote only. And now I'm back to you. Thanks.
Great. I really enjoyed those videos, and I hope you did too. And thank you very much again to everybody who submitted an application and who did all the work for creating those really excellent videos. Now, in the next session, we will move into breakout rooms, and there are 6 breakout rooms available. And to help you choose the right breakout room for you and your interests, our team of HRB subject matter experts has each created a short overview of their breakout room discussion topic. And we are now going to look at those in order so that you can choose the right breakout room afterwards. Thank you.
Hi, everyone, and thanks for listening to my brief talk. My name is Annalisa Montesanti. I'm the program manager for the Health Research Careers. What I'm going to introduce today is the concept of data management planning and the FAIR principle, and why the HRB as a funding agency in health research is supporting this practice. As we know, and you know more than me, the primary output of research project funded is often the data gathered and generated to support observation and validate the project. And to ensure that this data is used to its maximum potential, data needs to be managed properly from the earliest stage as possible during the research process and the life cycle of the data. And then the data should be preserved at the end of the project and should be made available for use as much as possible beyond the original project. And that basically brings to data discovery. The HRB, as many other funders globally, support good data governance, management, and stewardship practices. And then the FAIR data principle are endorsed by the HRB, and FAIR stands for data that are findable, accessible, interoperable, and reusable. This is different than open data. So FAIR data can be open or can be closed, and that depends on the license you apply. And we know that, of course, for working with the patient sample or other human volunteer, very often data cannot be open. So FAIR, it should be the base of how the data should be. The HRB introduced a policy for data management and data sharing in early 2020, and that's applicable to all funded activity where data is generated or is used. The policy is intended to promote responsible management and sharing of research data, and not only, also software and materials. And then we encourage as few restrictions as possible to maximize the value of research. And this is for patient and public benefit. Don't forget that, of course, HRB is a public funder. Data management stewardship plan is a formal document which describes how the data is generated, or is data other people data is reused, is managed, curated, and preserved. And that's very much the data stewardship part, where the project ends and the stewardship takes place. Data management and stewardship is an ongoing process, and the planning should start as early as possible and should continue throughout the project. To conclude, why you should manage your research data properly to increase efficiency, safety, quality, reputation, and compliance. Thank you very much for listening today, and I hope to see some of you at the breakout room later.
Hello, my name is Anne Costello, and I will be facilitating the Ones to Watch breakout room on research assessment. So in the breakout room, we'll be discussing research assessment in the context of the San Francisco Declaration of Research Assessment, which is DORA. And it came into force, and this is a declaration that came into force in 2012. So DORA is a global initiative that aims to reduce dependence on journal-based metrics, such as journal impact factors and citation rates, towards a culture where the importance is placed on the intrinsic value and relevance of research and its potential impact in society. So the HRB is a signatory of DORA and is fully committed to ensuring that research and researchers are assessed on the merit of their research as a whole and not just solely on journal-based metrics. The declaration also aligns very well with the HRB's effort to transition to an open research environment. So since 2016, the HRB has taken steps, particularly in the health research career-related schemes, to better align ourselves with the declaration. So in researcher CVs, we now also include questions asking for information on the researcher's contribution to knowledge, their contribution to research and career development of other researchers, their contribution to the wider research community and society, as well as a personal declaration where they can include any other relevant information which may not be captured elsewhere in their CV. So the aim of this approach is to provide a comprehensive overview of the value and the quality and the impact of the applicants or the researchers' work. It is important to note also that we provide guidance to reviewers about DORA, and we do expect them to review researchers based on DORA principles. So if you would like to join me in the breakout room to discuss research assessment in the context of DORA, then I will see you there. Thank you very much for listening.
Hi, I'm Patricia Clark, the Programme Manager for EU Programmes and Policy at the HRB. I want to talk to you about open science, the move towards making research more transparent, collaborative, accessible and efficient. In general, open science covers many different aspects of opening up the research process to allow others to participate at all stages, as well as to benefit as freely as possible from the research outputs once the research has been completed. Open research is not new. It brings together a number of key agendas to work in a holistic manner. These include open access to publications, enabling fair research outputs, infrastructures for open research, skills and competencies, and incentives and rewards. Open science has been embraced by all major policy leaders and funders, including the HRB. For example, through the preparation of HRB policies, by providing the HRB Open Research Publication Platform, by co-chairing the National Open Research Forum with the Higher Education Authority, or by becoming involved in EU initiatives such as the EU Fairs Fair project and the Council of National Open Science Coordinators involving other member states. Horizon Europe, the leading funding programme for EU research, has fully embraced open science as normal practice. Researchers who want to work at EU level are now required to work openly. We heard earlier about the experience in the Netherlands in moving away from the evaluation of research based on impact factors. Horizon Europe will do something similar. Open science is a cultural change of a large scale and demands a whole system approach that engages all levels of the research system. In Ireland, working groups under the National Open Research Forum are aiming to define coordinated open science actions for research and for researchers across key areas, and these are due in 2022. Success for Ireland and for the HRB ultimately depends on the participation of researchers in implementing change. It is vital that researchers such as yourselves are adequately prepared for this research environment. The Open Science Breakout Group aims to explore your views and experiences on open science practices. I look forward to hearing from you and discussing some of the ongoing work in the HRB and further afield. Talk soon.
Hello, my name is Aoife Cahill. I'm Programme Manager for Investigator-led Grants and PPI in the HRB. Today I'm going to co-host a breakout room on PPI with my colleague Chiara Mazzoni. So what do we mean by PPI? When we talk about PPI, we're talking about public, patient and carer involvement in research. We're talking about research being carried out with or by members of the public, as opposed to, for, or about them. When we talk about the public, we're talking about everybody. We're talking about patients, carers, their families, future patients of the health service. And when we talk about PPI, we're talking about an active involvement in decision making, so having an active role in the project. We're not talking about the research participants that you may have included as part of your project. So why are we interested in PPI and why are we doing it? Well, we know that members of the public, they can provide a different way of looking at things and they can bring their lived experience to the research that's being carried out. And there's numerous benefits of PPI. They can include having your research be better planned, improving the experience of research participants you may have, and also including the relevance of the research that you're carrying out. So ultimately leading to better research. So where can you bring PPI into your research? You can bring PPI into your research at any stage of the research cycle. So right at the beginning, when you're identifying and prioritizing your research question, to the design of your project, to the management of your project, and then right through to when you're trying to interpret the results that you have, and then also through to the dissemination of those results. So if you'd like to hear more about PPI, please do join me today for the breakout room on PPI. Thank you.
Hi, my name is Anna Cody. I'm Head of Investigator-led research careers and enablers in the HRB, and by now you will have seen a good bit of me. I'm going to talk about the breakout room on HRB funding calls. And first, I would like to tell you what this breakout room is not. It is not the only place to get information on when we're planning which new calls. Each participant will get a call calendar for 2022. And at time of recording, I am working with my colleagues to collate information. The business planning for 2022 has just started, and therefore the calendar might not be absolutely complete, but it should give you a good overview. Hopefully you will have received this by now, but if not, we will make it available as soon as possible. So if you are just looking for a calendar, there is no need to join this particular breakout session, and choose one of the others. What we will do in this session instead is that we'll have a conversation about some calls that you might have specific questions about, and I will answer whatever I can, and where I might not be able to give you a full answer, I will connect you with somebody who can respond to this outside this session. I'd also like to talk about our selection process, including the panel and interview process and what feeds into funding decisions. I would also like to mention our Observer initiative that we use to increase transparency, and that will hopefully help you to get good feedback on your draft applications from your research office. And if we have time, we might also be talking about tips for grant writing. So that's the plan for this breakout session, and I'll hope to see you later. Bye.
Hi, my name is Catherine Gill and I'm Programme Manager for Targeted Programmes and Evaluation at HRB. And in recent years, I've been involved in implementation of our research integrity policies. And that's what we're going to talk about in our breakout room today. Research integrity and what a supportive environment for doing good research should look like. But we all set out to do research with the best intentions. So why such a focus on research integrity these days? Science Europe put it rather nicely a few years back with its 7 reasons to care about research integrity. Firstly and fundamentally, research integrity safeguards the foundations of science and scholarship. So you can trust the published record, you can build on it and contribute to it, knowing that others too can build on your outputs. It maintains public confidence in researchers and research evidence. And we've seen how important that has been throughout the pandemic, with a particular example in Ireland being the trust in vaccination. Linked to that, when research is valued, there's continued public investment. From a researcher perspective, research integrity protects reputations and careers. And from the patient and public perspective, it prevents adverse impacts. And again, the pandemic would throw up plenty of examples of where people acted on what we might consider less than robust research evidence. Research integrity also promotes economic advancement, and something that's very close to the heart of the HRB, it prevents avoidable waste of resources. So it's a bit of a no-brainer even for the less altruistic amongst us, and I don't think anyone would argue with the need to ensure research integrity, but the question is how. There have been lots of declarations and position statements and principles published in recent years, and these are really helpful, but how do we translate integrity principles into practice? So today we're interested in exploring with you, the early and mid-career researchers, what you see as the challenges in trying to do research with integrity. From your perspective, what are the stumbling blocks when it comes to areas such as research assessment, mentoring, publication? How do you solve the dilemmas when they crop up, and who do you talk to? We'd like to share with you some of the resources that are out there, but also to hear from you on the reality of doing research with integrity in the very demanding world of health research today. So I'll be joined by my colleague Maura Heine, who's played a leading role in the promotion of research integrity in Europe over the last decade, including the coordination of the revision of the European Code of Conduct in 2017. And she'll be delighted to share her expertise in all things research integrity with you. So we'll see you there. Thank you.
Great. Thank you very much to my colleagues for preparing those videos and to give you an idea of what those different breakout rooms will be about. If you have hopefully made your choice now and have had a little bit of time to think about where you would like to go, the instructions for selecting and joining your room of choice will be made clear on the platform. So please have a look there. And when you select your room and click join, there will be a pop-up message that will advise you that there's a Zoom link located in the session information box to the right-hand side of the screen. So just follow those instructions. You can obviously only choose the one room at the one time. None of us can bilocate. And we now move into a 10-minute break. That's to facilitate everybody to move across out of this main session into their chosen breakout session. And we will see you there.